Hi, my name is Cassandra Bray, and my topic is pregnancy and substance use. I created an awareness poster on this issue to portray the dangers of using drugs while pregnant. This also enlightens the public on the issue to do further research. These are some quick facts on the issue that I'll discuss later. I want everyone to consider if drug alters the brain's chemistry and the body's ability to respond to stimuli in a developed adult, what do you think it does to a developing fetus? A pregnant woman has to eat, drink, and breathe for two people. So, what the woman puts into her body, the baby receives as well, causing the baby to receive fewer nourishments. What is pregnancy and substance use? Pregnancy and substance use is a woman who continues to use drugs while pregnant. This puts her child at risk of adverse health effects. Most women who are trying drugs for the first time are when most women are of age to have a child. To understand the question I asked previously, drugs enter the body quickly and affect a fully developed adult. Yet people will vary in how the drugs affect them, but drugs still alter the brain's chemistry and a person's reaction rate decreases. With this in mind, the body is getting the drugs and becoming dependent on them, which will cause them lifelong health issues because their mother chose to continue to value their drugs over her child's life. What is the issue? The issue is that drugs are highly addictive and people are dependent on them. So many would find it difficult to stop using drugs for the 9 months of pregnancy. But many women who continue to use drugs while pregnant are addicted to them. So they are constantly craving the drugs and will go to any means necessary to obtain the drugs. Since people will avoid withdrawal symptoms, especially when pregnant. Once a drug has entered the body, it passes through the bloodstream to the placenta, which will reach the fetus. The way nutrients and oxygen are passed to the fetus is the same way drugs get to the fetus, causing fewer nutrients and oxygen to reach the fetus when a woman constantly uses drugs. This makes the fetus grow dependent on drugs, resulting in adverse health effects, such as dependency on drugs when born, withdrawal symptoms, congenital disabilities, behavioral problems, mental retardation, and premature birth. Most of these symptoms are under the conditions of neonatal absence syndrome, NAS, and fetal alcohol syndrome, FAS. It is painful to allow a child to endure these symptoms, so pushing to make sure women are not turning to drugs while pregnant is crucial. So these children are not forced to struggle with these adverse effects because their mother did not halt their drug use for 9 months. Some statistics I wanted to enlighten people on are 15% of women are using drugs during their pregnancy. The most commonly used drugs are alcohol, nicotine, marijuana, and cocaine. This is exposing over 2 million babies to drugs. The most surprising statistic is one baby every 19 minutes is born with neonatal absence syndrome. Lastly, to illuminate the issue of pregnancy and substance use, about 1 in every 5 women have admitted to having an alcoholic beverage while pregnant. These statistics are so high since most women who will experience and participate in drug use are of childbearing age. Many people have differing views on the issue of pregnancy and substance use, and there are many cases where women are criminalized for using drugs while pregnant. Giving women harsher punishments was to deter other women from continuing to use drugs while pregnant. The idea is supported by deterrence theory, which focuses on providing longer sentences to prevent others from crime. But it does not exactly work like that since crime has not stopped. Officials tend to perceive drugs use while pregnant as child abuse so that women can be incarcerated for it. Even though the child is not born yet, the mother abuses the fetus by taking drugs to cause lasting effects. Many believe it should not be a criminal offense and they cannot have parental rights, while others feel women who are using drugs during pregnancy require help and support through treatment. Treatment can better help them become sober and understand their wrongdoings. When searching for cases to use in a presentation about pregnancy and substance use, I wanted them to be about different aspects of the issue. One case that was decided on December 12, 2022 in Rockland County, New York, pertained to a woman who gave birth in 2020. Due to reasonable suspicion, the hospital ran a drug test on the baby and sent it to the lab. The drug test tested positive for methadone and benzodiazepines, forcing the baby to stay in the hospital to be treated for withdrawal symptoms. Social services and child protective services requested that the baby not go home and be placed with foster parents since her parents were charged with negligence due to using drugs. The courts did further research and found the father had a long history of illicit drug use, especially the drugs that were in the baby's system. He also refused to cooperate, and his stories never lined up. This is just one example that shows that drug tests should be mandatory before and after a woman's pregnancy and for the baby, so people can give them treatment and discourage their drug use. This is essential in reducing the issue of pregnancy and substance use. Another case was a 23-year-old woman arrested during a routine traffic stop when police officers found marijuana in her vehicle. She told the police officers that she had smoked 2 days prior and that she found out she was pregnant today. In Alabama, one law states that you cannot post bail if you are pregnant and arrested for a drug offense. This is in place since abortions are illegal in Alabama and they prioritize the safety and health of the fetus. Officials were adamant about sending her to rehabilitation to keep her sober so that her baby would not suffer from any adverse effects when born. But she was denied since she was not addicted to marijuana, thus making her have to stay in jail until her court date. But the jail was overcrowded and her bed was already taken. This woman was pregnant and forced to live in unsanitary and unsafe conditions until her court date, which could have been a while. Officials have the right idea of sending her to rehabilitation, but these treatment programs must be more readily available for everyone to be helped. 3 preventive methods that I think would be effective in reducing the number of pregnant women using drugs are reforming the education taught, the number of treatment programs, and mandatory testing procedures. Health classes already teach about drugs and their effects, so adding an essential lesson concerning pregnancy and substance use is important, so teenagers can learn and understand the dangers, effects, and outcomes of using drugs while pregnant. This is important because many teenagers do not know the effects, and this is the age when they will start to experiment with drugs. If more women knew about the horrible adverse effects the baby would have, fewer women would be using drugs while pregnant. This is important to teach so teenagers will remember that SAMHSA is only a phone number away. Treatment programs need to be more readily available so these women can get the help and support they need to get off these drugs instead of being incarcerated for them. A significant increase in the number of treatment facilities and programs need to occur so that people who are highly addictive and casual users can attend. The people at these facilities can help women stop using drugs, understand why they cannot use drugs while pregnant, and discourage them from future use so their children are not neglected. Women must get off these drugs so their babies can be healthy too. Some treatment facilities are changing women's focus from the drugs themselves and finding ways to help care for the fetuses, addiction treatment, and healthy eating. Lastly, making it mandatory that women who are trying to become pregnant, women who gave birth, and the baby born must take a drug test to test negative for drugs. This will show if women who are trying to become pregnant should receive treatment and become sober before having a child. Women who just gave birth need help understanding their wrongs and to be sober for their child, and for babies to receive the treatment they need. This is crucial because this will lessen the issue of pregnancy and substance use. SAMHSA stands for Substance Abuse and Mental Health Services Administration. They have a national hotline to aid the efforts in advancing the behavioral health of people. Please call 800-662-4357 if you are in need of someone to talk or in need of help and support. Do not be afraid to call. There are people ready, willing, and able to help. And these are my references. Thanks for listening.